everyone and welcome back to my channel. If you're new here, I'm Dr. Darpan Kaur and I'm an aesthetic and maxillofacial surgeon, and I'm here to educate you about all things related to medicine and healthcare. So if that's something that interests you, don't forget to subscribe for more content. In today's video, let's talk about what options you have in case you have a missing tooth. So as most of us know, one can lose teeth owing to age, dental diseases, trauma to the tooth or jaws, or they could also be missing since birth. But were you aware that going for prolonged periods of time without replacing a missing tooth can lead to several complications? Supraeruption means that the tooth of the opposing jaw may erupt further into the empty space, leading to occlusal disharmonies. One can also experience difficulties in chewing. And the other thing that can happen is drifting of the adjacent teeth into the empty space, once again creating occlusal disharmonies. Collapse of your facial profile may also occur. However, there is an increased risk of this happening in patients who have a large number of missing teeth as opposed to one or two missing teeth. Loss of bone in the area of the missing tooth can cause difficulties in dental rehabilitation. And lastly, it can cause self-esteem issues. Missing a tooth can look unappealing and cause you to stay away from social situations. So we have 5 options and we're going to discuss them starting from the one that costs the least to the one that costs the most. So without further ado, number 1, no treatment. While certainly not ideal, it is the easiest, cheapest and least time-consuming option out there. However, there are certain issues associated with this. There's always a catch, isn't there? So while the advantages include no financial demands and not being subjected to any further treatments, there are certain disadvantages that may result, such as movement of the adjacent teeth into the missing area causing alignment issues, inability to efficiently chew from one side leading to overuse of the other side of the jaw, and of course over-eruption of the opposite tooth into the missing area causing once again alignment issues, inability to close your jaw all the way leading to jaw pain or fracture of the existing teeth. Your second option is a removable partial denture, also commonly known as an RPD. So as the name suggests, these are dentures resembling your missing tooth which can be placed in or removed on demand. They come with clasps that attach onto the adjacent teeth which prevent them from falling off on movements like talking or eating. RPDs easily replace the area of the missing tooth, are easy to maintain, cost minimal and are impermanent. However, they tend to shift around quite a bit in the mouth while eating, leading to difficulties in chewing. They accumulate food debris underneath them, compromise speech and function. They also tend to accelerate the bone loss process in the area of the missing tooth. And lastly, they tend to loosen the teeth from which they take their support over time, which makes them a poor choice as a long-term treatment option. Option number 3 is a resin-bonded prosthesis. This is also known as a Maryland's bridge, and while it's been used in dentistry since the 60s, it has proven itself to be a rather unpredictable treatment option because of its poor and uncertain longevity. Even though it requires minimal tooth preparation, is conservative, reversible and aesthetic, it has been found that almost 50% of these prostheses tend to deteriorate within 3 years' time. There is also a risk of decay and loosening of the teeth from where it takes its support. Option number 4, fixed partial denture, commonly known as a dental bridge. So FPDs or bridges are one of the most common treatment modalities for single tooth rehabilitation and have shown a high success rate. These prostheses can be fabricated and placed in the mouth within 1 to 2 weeks and provide comfort, aesthetics, proper function, speech and health to the patient. One huge plus point is a lack of surgical intervention. What's important to note here though is that the missing tooth being replaced takes support from the adjacent teeth. This requires the adjacent teeth on both sides of the missing tooth to undergo endodontic treatment, that is, a root canal treatment before they can be prepared by reducing their overall dimensions to accommodate the bridge. So instead of a single crown, 3 to 4 crowns are fabricated and placed. This of course is an irreversible treatment, and in the future, should failure of any of the root canal treated teeth occur, the entire bridge will have to be removed and the whole process will have to be started from scratch. Loosening of the supporting teeth is also a common complication that may occur over time. Lastly, we have dental implants. Gone are the days when the patients needed to accept the limitations that came along with bridges and subject their healthy teeth to undesired root canal treatments in order to accommodate a dental bridge. Dental implants have completely revolutionized dentistry and are now considered the gold standard to replace a missing tooth. Dental implants act like a screw that get incorporated inside the jawbone, much like a tooth root from where they receive their impeccable stability. They show a high success rate, do not require preparation of the surrounding teeth preserving them, have excellent aesthetics, and maintain the bone height and width. It is, however, an expensive surgical procedure that requires a certain amount of bone to be present in the area of the missing tooth. It also has an increased treatment time ranging from anywhere between 1 to 6 months, and if performed by an inexperienced surgeon, can lead to treatment failure. I suppose all this begs the question, which treatment is right for you? Your dentist will be your trusty guide on this journey, for they possess the knowledge and the skill set to best guide you. It is important to remember that teeth can not only affect your smile but also your overall physical and psychological health. It is important to consult with a dental professional to find the best treatment plan tailored just for you. I hope the contents of this video helped shed some light on your tooth replacement options and can help you make informed decisions in the future. Remember to like this video and please subscribe for more content on medicine and healthcare. Until next time, goodbye and see you.